Hello everyone. I'm doing this video after a long time and everyone raised this question why there's no videos and the channel is on pause. So actually the reason why I didn't do a video for a long time is the thing on this topic, the AMC part 2, because I was committed to AMC part 2. I was doing AMC part 2 and just cleared it. So I thought sharing my experience and just because most of the people are struggling with AMC part 2 and I of course did to share my tips and tricks and things I learned AMC part 2 in a video. And I thought of doing this video in English just because many people have requested to do a video in English in the comment section. And the audience, of course, has some people from India, Bangladesh, Pakistan, who, of course, would like to have a video in English. So that's why I thought of doing this video in English. So for the start, I would like to tell a few things about AMC Part 2. So this is the exam which is the second part of going to the general registration in the standard pathway. So many of us, the junior doctors who start their jobs in Australia, take the standard pathway, that is doing AMC Part 1, and then start their job and getting the clinical practice which we need for the general registration. That of course consists of 47 weeks of total clinical practice in hospital, consists of 8 weeks in emergency department, 10 weeks in medicine and 10 weeks in surgery. So with that, the other thing we need to complete for the general registration eligibility is AMC Part 2. That is for the standard pathway. Before starting, before start talking about AMC Part 2, I would like to tell a few things about what are the other alternative pathways, because many people are in this question just because some people struggle with AMC Part 2 and some just don't want to do AMC Part 2. So people want to know, are there any other alternative pathways which we can follow? Of course, yes. So I actually didn't know there's any other pathways when I started working here. So eventually I got to know many people take few alternative pathways. One is doing PLAB. So many of my colleagues in Sri Lanka listening to this video at the moment must have done PLAB 1 as a part of their screening exams and getting ready for the pathways while in Sri Lanka. So if you have done PLAB 1 already, you got an option after start working in Australia, you can do PLAB Part 2 in Australia. Then you are eligible for the standard pathway registration, but not as an AMC graduate, but standard pathway completion with PLAB Part 1, 2 and AMC Part 1. So that is one pathway which many people take, but of course many people don't know. That is one. The other one is workplace-based assessment. This is quite famous. Everyone knows about this. So there are a few advantages and of course disadvantages of taking this pathway. So advantage is you don't have to do AMC part 2. That's the advantage. So that part is taken off in workplace-based assessment. But the other hand, you need to secure a post in workplace-based assessment center, which is very competitive. And imagine you are securing a post in a workplace-based assessment center. So you of course wondering what are these centers which give workplace-based assessment. You can go to the MC website and they will give you a list of the hospitals which give workplace-based assessment. So imagine you got a position in workplace-based assessment center, but still they will make you wait for maybe 1 year or sometimes 2 years to be eligible to get into the workplace-based assessment position. So it's a bit competitive. Getting a position is competitive. When you get a position, like securing a WBA spot in the hospital is again competitive. And it is expensive. I'm not sure about the exact amount that it needs, but it's more than $10,000. So these are the pros and cons about going for a WBA, but you have the freedom to decide and to take which pathway is like best for you. Then if you're doing AMC part 2, so some people take their turns and do it like different times based on their timeline. So what I did was I started working in Australia after MC part 1, and while in Australia I started preparing for MC part 2 and I cleared MC part 2 in my second attempt. So, and some people now, of course, because many people apply jobs from Sri Lanka, there are few who do try doing MC Part 2 from Sri Lanka. When it comes to MC Part 2, it comes in two formats, that is face-to-face and online clinical exam. So from these two formats, only online format is there for this year because they are trying to build a dedicated exam center for the MC Part 2, and that is why there's no face-to-face format this year, and we are quite not sure about the next year. Maybe they will open the face-to-face format again. Online clinical exam is not something that we are used that much back in Sri Lanka because clinical exam has always been a real clinical setting in a hospital with real patients for us, especially throughout the training and of course in the final year. So the online clinical exam itself comes as a challenge to us. For my first attempt in AMC Part 2, that is the very first reason that I've decided I will go for face-to-face format because that is the thing that we used to for that is embedded in our nerves as medical student and even after the graduation. But these two formats comes with their own differences, especially in the physical examination domain, because in face-to-face, physical examination is you do it on the patient or a dummy or a simulated patient, but in the online format, it's completely different. You need to explain the physical examination and you need to explain everything in anatomical terms and incomprehensive to a doctor or a medical student. So both formats come in their own differences. That is something that is the first point in decision making in MC Part 2, what format to choose. I'll tell you more in the rest of the video about these two formats and what are the differences in each category in these formats. After doing both these formats, I realized there's quite a bit of a difference of these two, which I'll explain to you in the rest of the video. So let me tell you about the clinical structure of the exam, clinical consistency of the exam, which is very common to both these formats, online and the face-to-face format. This exam consists of 16 clinical stations. These 16 clinical stations are divided into 4 slots and has a rest station in between every 4 stations. So altogether there's 20 stations that you need to rotate during the exam. The scoring of the exam is like 9 out of 14 stations. This 14 number comes because there are 2 stations within these 16 stations which are non-scored, that is pilot stations. But we don't know what these pilot stations are, so we perform all 16 stations and there are 2 stations which are not scored. Then from those 14, we only have to score 9 stations to pass the exam. This has recently been reduced from 10. The pass mark has been 10 the last year, but now it is 9, which is really good. So this is the structure, the frame of the exam. Let me tell you about the consistency, what this exam consists of. I think this bit is the most important essence to plan and pass this exam, which I of course didn't know in my first attempt and nobody was telling me what this exam consists of. I eventually realized getting ready for it in the second attempt, look, there is a structure, there is a format for this exam. So there are 4 types of stations in the exam. I'll tell you all 4 types, then every question which comes in the exam falls into one of these categories. If you find what this question pattern is, what this question category is, you can pass the station very easily because the scoring entirely depends on whether you perform understanding the station, whether you know what the task is. So that is the, I think, one secret to pass the exam. So the first one is very straightforward type, that is examination. So face to face, we just need to perform the examination just like we do back in Sri Lanka, back in home, performing the examination on actual patients. Sometimes they give simulated patients, sometimes dummies, and there's an examiner scoring on you, how you perform your techniques and your examination, and you interpret findings. Online is pretty different. So in online exam, we have to tell in detail with the anatomical landmarks and medical terms how we examine the patient, how we examine the system. So it is like telling to a medical student or telling to an examiner or a senior doctor how we perform this examination. So we have to be very precise in telling examination, but compared to actually doing it within this time frame, it's comparatively bit easy for me. but it is very personal. Everyone find it very difficult. Sometimes people find it doing it easy, sometimes like telling it, like explaining it is easy. So that is the examination station. Usually there are 3 or 4 examination stations in every exam. The second type is the management questions. That consists of counseling and education. I feel like this is the tricky part that many Sri Lankans find difficult to do because this counseling and education part is very different. The style and way of doing it very different, entirely different to the way we did it back in Sri Lanka. So like getting into this style and this communication pattern is bit of a struggle for many of us. I of course did struggle like getting into this pattern. So this will be the tricky part for everyone. We need to establish very good rapport. So if you are doing it correctly, you will see the patient will respond and patient will behave in a manner, the simulated patient will behave in a manner that you will pass the exam. And it should be in layperson language. There's no medical terms in explanation and counseling. And patient interaction and two-way communication is very important. So there are lots of videos and lots of role plays on the internet which you can listen. I of course will try to do a video on this part because it's very important and might be the key to pass the exam. So there are 3 or 4 stations of this category. It is management category, counseling and education. So it's a part which you need to think twice whether you are entirely ready before going to the exam. The third one is diagnostic formulation. This is the normal long case we had back in Sri Lanka. So it's like a final exam long case. So we need to take a detailed history and differential diagnosis, and we need to give the differential diagnosis at the end of the case. So it's very straightforward. We take the history, exclude differentials, and give our diagnosis. So this is something that we are not struggling that much. The other one is the fourth one is history taking. So this mostly consists of thorough history of a common case. It's not hard to diagnose. The diagnosis sometimes is already given in the stem. So it's mainly focused on elaborate history taking. So that is the fourth type. It's a bit different from diagnostic formulation. In diagnostic formulation, you need to diagnose. It's a bit tricky to diagnose. You need to come up with at least some differentials if you can't come to the diagnosis exactly. So these 2 types are a bit different. So if you have come across some feedback which the candidates get after the exam of one of your colleagues or peers, you might have seen these formats. It's in their scoring system. So every question, they divide it into these 4 parts and they give a score. So if you want to have a better idea, like how they score and how these questions are divided, I would advise like to look into a exam feedback or exam scoring sheet of one of your peers who have done the exam. Then you will get a better understanding with all this information that I just gave you. So these are the 4 types of questions that you get in the exam. So although those 4 types of questions consist of main disciplines that we have studied for our final years and throughout the career. So that is medicine, the first one. So most number of cases of these disciplines come under medicine. So I did start studying with medicine because most number of cases were in medicine. And there are speeds cases, pediatrics, gyn and obs, psychiatry, and physical examination. So these are the categories which these 4 types of questions consists of. So with all this information, I think you must have got an idea how the structure of the exam is and what is the consistency of the exam is. So every clinical station is 8 minutes. You get 8 minutes to perform. Total time is 10 minutes. So when the bell ring, we start reading the instructions and reading the task. That is for 2 minutes. And we get time to get ready for the task, to perform the task within these 2 minutes, reading and getting ready. Then we need to start performing in the next 8 minutes. So total time for the station is 10 minutes. Many people have this question how the online format works. It's like you do the online exam from home, but there are certain particularities that you need to meet, setting the environment in a empty room with no disturbances and certain technical requirements, the computer, the audio and video requirements that you need to submit to AMC before getting ready for the exam. and you do the exam at home, and exam goes from 9:30 a.m. to 4:30 p.m. with the lunch break in between, which is the observed lunch break. So that is the basic, very basic idea about the structure of the clinical exam in online format. And face to face, of course, there are centers, one in Melbourne. So you go to the exam just like going to some clinical exam, and it is like rotating between these stations in one go. And there's no break in between except the rest station for 4 minutes, for 10 minutes in between every four stations. So that is the basic structure of these two types of exams in AMC Part 2, face-to-face and online, and what it consists of. So the next part of the video, I would like to talk about how to plan the exam. So this is again a question for many people because uh, the first most question which comes is that many people ask from me is it good to plan exam while in Sri Lanka? Like, because it makes you more suitable for a job, and it increases it actually doubles the chance of getting a job in Australia very soon, because you are almost eligible for the general registration with the clinical practice. So many people are in a thought of whether it is suitable to do the exam while in Sri Lanka. So there are pros and cons of that. Of course, the pros are like you are getting twice eligible for a job with the AMC Part 2. And there are some centers, there are some hospitals on which only take candidates, only take doctors with AMC Part 2 who are like entirely ready for the general registration. So that is the biggest advantage of doing AMC Part 2 while in Sri Lanka. And the cons are like the exposure that you get to the healthcare system in Australia, and especially communicating with patients and understanding how to communicate, how to talk to people, how to make them understand. The communication is quite different in here, the style is different, and the management is of course different, but you can study it in the notes and the courses. But the way of communication is the thing that which comes with practice in Australia. So that is something, the biggest disadvantage of doing exam from Sri Lanka, because you lack that exposure and you don't have that exposure to talking to the people and talking to real patients in the setting. So that can do an impact on your performance in the exam. And the other thing is the cost, of course. So it is $4,700, the online format exam this year. So it's quite a bit, a huge amount not to risk for. So that is something definitely we need to think about, think twice before taking this big step, because it's time consuming. It at least takes 6 months to entirely be ready for the exam, and the amount of money you put into it. So those two are two reasons to think about whether you really need to do the exam. So the decision making is very personal. It depends on the personal factors and urgency of getting a job, and how committed you can do the exam from Sri Lanka, and the capacity of you to spend that money. So that is the my pros and cons for doing exam in Sri Lanka while in Sri Lanka. So the exam booking is the next question many people want to know about. Exam booking is very competitive. They have the last booking, they changed the booking system because there were few instances where people made the payment and didn't get their dates, and AMC had to end up giving the future dates in advance to the candidates who have already paid. So they have changed their booking format this time. Now it is like expression of interest for some dates, and the AMC will decide and will give you a date. So if you have made the decision to do the exam, the first thing is booking the exam, expressing your interest to do the exam in a certain period, then the AMC will give you the date. So booking is again bit competitive. So make your mind in advance and take the decision in advance, because the booking you have to make on the exact date at the exact time. And the time frame to get ready for the exam is another question which many of us having in our mind, like thinking about this exam. So in my personal experience, it took me 6 months to get ready for my first attempt. I was ready entirely in 6 months, but it depends. If you're working in a very hectic unit and you don't have time to study, and if you're committed with family commitments and you are moving to Australia in between the time of your like in between you are getting ready to the exam. So it is very tricky. But if you can commit to study and to do the role plays and get ready with every case, 6 months is more than enough to get ready for the exam. Like, be entirely ready not to risk the attempt. So 6 months is the usual time frame that many people go for. And the other thing is how to get ready. Is it like studying by ourselves or like group study? So this exam is mainly we need a study group or at least a study partner because it's a clinical exam and we need to practice role plays. All these cases are role plays. So if you do role play for all these cases, it's a very positive thing and it's a high probability that you pass the exam. So it's very important to build that study group which is like entirely very comfortable to you and in your zone that you feel comfortable to communicate and to practice, or like a study partner, one study partner that you can practice every day. So I did study in a study group in my first attempt, and many people did their different paths, and some people passed the exam. So I did study with one study partner in the second attempt, but didn't make much difference. So it is very personal decision and a personal preference, but having a study group is very important, which is very comfortable to you. And the other question, the burning question is courses. What course to do? So there are like many, like more than 10 courses in Australia, which makes you ready for AMC Part 2. But to be honest, I did not do any course for myself, but I did do Dr. Riley's mock exams in my study leave. I did 4 mock exams to make sure that I'm 100% ready in my second attempt. So that's what I did, but it's very personal decision. But if you want to see which course suits you, I think the best thing is to get the feedback from your peers, from your colleagues who have done the courses recently, and you can get the study material and the course materials. You can have a look at those materials and decide whether is this the course that I'm seeking? Is this the material that is comfortable to me to study? Is this my format? So likewise, you can decide whether this what course to go for. And I don't think every discipline, every case in the exam does not need coaching if you can self study. Some parts, like some people find physical examination tudes are important because telling physical examination in an online format is not something we have done before. So having some course for physical examination is good, and the other thing is having some coaching for counseling part, counseling and education management part is helpful for a lot of people. So those two are the things that some people go for coaching. Many Sri Lankan students, many Sri Lankan candidates go for coaching. So, but again, going for a course and enrolled in a course is a very personal decision, which is a tricky decision because all these courses are again expensive and time consuming. It takes some time of your study. So you need to invest some time on these courses. So take the decision. Take the decision with your personal preference and the course you really need to do. And the other thing is how to start preparing is the this is the last part of this video. So how to start preparing for the exam. So what I did was soon after moved to Australia last year, I met a friend who has done the exam recently, but not from Sri Lanka. She of course told me these few basic things, what this exam is. I had no idea. I had zero idea about the exam when I walked into her. So she gave me a basic idea what the exam is and gave me some material. So I did a read and I was watching few of my friends who were sitting the exam in the next couple of months doing role plays. That helped me to understand what this exam is. Okay, this is something that it is something like this. They do role plays and this is what they do in the exam. So it makes you understand what this exam is. I would really suggest if you are in the initial stage of planning the exam, watch some role plays that your friends do and like observe what they are doing and how they study. And I did listen to role plays. There are plenty of role plays of many courses on the YouTube internet. Then you can have a listen and understand what this exam does and how it happens. Then I started studying with medicine. I did read all the medicine cases and slowly started doing one or two role plays with my study group. Then once I was tuning up with the role plays, we started doing more role plays and reading. And reading AMC handbook is very important. So what I did was reading the handbook at the same time with the tudes and the notes I got from my friends and the notes that my friends have made already. So I did read everything together for one case with the AMC handbook and I made my own note. So that's at the end of the day, that note was the thing that I studied just before the exam. And it went really well, having everything in a handy one sketch. So, and about the study leave, of course, this exam warrants some study leave. I went for a 1 month study leave. It depends on where you work. In a metro station or a rural station, different stations have a different capacity to support you with the study leave. If you are in Australia, but of course it's different if you are in Sri Lanka. So you can request for a study leave and plus 2 weeks of exam leave, and most stations will facilitate that leave, and that is very important to make sharp everything, do final role plays, do all the revision, and get ready for the exam in a sharp manner to be ready and to be 100% entirely ready for the exam on the day of the exam. So that is what I did throughout this process of starting, getting ready, and the final bit of sharpening for the exam. This in this video, I took you through what AMC Part 2 is, what sort of an exam it is, and what are the other alternative pathways if you are not keen to, or if you don't want to take AMC Part 2, and if you are decided to take AMC Part 2, what sort of structure it has, two formats, online and face to face, and what consistency it has, different types of questions that you get, and what disciplines, and how to score and what pattern it comes. And I was talking about how to get ready, how to start, courses, common doubts that you got, and how to start studying and planning. Uh, I might talk about the common two cases that I was telling you, the counseling part and the physical examination in another video, how to start on preparing for that, and the tricks and the communication skills that you need to develop for those stations. If you find anything else that is not clear about AMC Part 2 and having any other doubt about this exam, just comment in the comment section. I would try in the next video to answer those questions and clear those doubts. And thank you so much. Bye.